Industry partnerships within the academic community have had mixed reviews over the years. Research funded by traditional resources such as NIH and NSF have been the mainstay for many seasoned research faculty, but the federal funding environment can no longer support the research enterprise in the same manner we have grown accustomed to. Sustainability of our research environment will require alternative approaches to funding resources. To help us consider other options, we have gathered a panel consisting of an up-and-coming university researcher, as well as seasoned research facilitators. Facilitators who have been on the industry side, starting up companies, and have worked to establish research partnerships through licensing and sponsored research agreements. Throughout the process of exploring the skills needed to build our culture at ECU, we've gathered great advice from previous sessions, such as dare to be different. Free resources are good resources. Use your passion to get to reality, and there are experts on campus that are here available to help you. Today, you should hear that industry partnerships are a valuable tool in your toolbox as you begin to translate your project into productive outcomes. Helping us deliver today's message on partnering strategies are 4 outstanding panelists. First, we have Marty Vance on the end. Marty will serve as our discussion facilitator today, and many of you will recognize Marty as the MC of the previous Idea to Impact forums. Marty serves as the founding director of ECU's Office of Technology Transfer. Her path to technology commercialization began over 30 years ago when she served as an assistant geologist for an underground construction project in Rochester, New York, and later in designing coal mines in West Virginia. She transitioned to the U.S. Department of Energy and learned valuable skills in federal court and property management before relocating to Research Triangle Park to serve as a federal contracts administrator for industry. Upon relocation to Greenville in 1991, Marty shifted to grants management with ECU's Office of Sponsored Programs, where she was charged with all grant and contract activity at the Brody School of Medicine. Throughout her time at ECU, Marty has served sponsored programs in a variety of capacities, ranging from grants manager, assistant director, and director of sponsored programs. Upon founding the ECU Office of Technology Transfer in 1995, Marty leveraged her experience in grants administration and contract negotiations to build a tech transfer program that straddles the line between research and economic development. On the research side, OTT facilitates negotiation of agreements for industry-sponsored research and the exchange of information and materials among academic and industry researchers. On the economics development side, OTT assesses inventions for commercialization opportunities, secures intellectual property protection, such as patents, and licenses these inventions to companies that range from multinational pharmaceutical firms to biotech companies and new startup companies. Next, we have Bob Fick. Bob is a physician by training, having graduated from Northwestern University and completed a postdoctoral fellowship at Yale University. Recently retired from Merck Research Laboratories, Bob looks back to nearly 20 years in escalating roles of translational research leadership in industry that began with Genentech as a staff clinical scientist and transversed to group leader and director of experimental pathology and preclinical pharmacology with DNA-X research to senior director of experimental pathology and pharmacology and discovery medicine at Schering-Plough Biopharma. Then as head of respiratory and immunology strategy of the biologics division of Merck Research Labs until his retirement in October 2013. His breadth of research and development experiences includes development and oversight of research plans, including target validation and discovery biology for novel targets, creation and implementation of preclinical predictive sciences group and translational medicine program, including murine and primate models of human autoimmune and respiratory diseases, respectively. He serves as a member of research leadership teams, guiding lead selection and design of bio-better protein therapeutics, providing competitive advantage for Merck Research Labs. His senior management experiences include establishing effective department organizations, designing and recruiting core labs, and managing new science departments to meet the needs of a growing biotechnology enterprise within a global pharmaceutical company. Bob has successfully established productive working relationships in a highly matrixed organization, bicoastal across preclinical functions, inter- and intra-therapy area franchises, and with extramural academic and biotech collaborators. Bob's intersection with ECU research began years ago while practicing medicine and collaborating in the research at the University of Iowa with Jim Mettensker. For those of you with a long history here at ECU, you may remember Jim Mettensker as a leading clinical researcher in respiratory medicine. I'm sure Bob will share more with us during the discussion how his relationship with Jim evolved into a long-lasting relationship with ECU. Next on the panel, we have Roy Carter. Roy is the Senior Director for the development of the Marine Biotech Center of Innovation, one of several centers of innovation launched by the North Carolina Biotechnology Center. Roy has over 25 years of diverse life science research and development and technology commercialization experience. More recently, Roy worked as a consultant helping university tech transfer offices evaluate and commercialize new life science inventions, and private clients translate technology platforms into new business sectors. Previously, he was Director of Biochemistry at BioWarn LLC, a biosensor company focused on bioweapon detection. He established and led biology, chemistry, and technology application teams before becoming its Chief Scientific Officer. He then co-founded Bioemics Incorporated, a startup to apply the biosensor for point-of-care diagnostics. Prior, he held a staff scientist and project leadership position at Novartis and Syngenta, initiating new projects in agricultural biotechnology for insect-resistant crops, animal feed, and cellulosic biofuels. Roy completed 2 postdoctoral appointments related to molecular genetics and cell biology of cancer, including development of novel live cell imaging methods. He received an undergraduate degree in applied biochemistry from Liverpool Polytechnic and earned his PhD in genetics from the University of Nottingham in England, where he is recognized as an early pioneer in the development and application of DNA fingerprinting methodologies for use in ecological studies of wild birds and animals. And last, we have Dave Brown. Dave Brown is an associate professor of physiology at the Brody School of Medicine. Dave received his undergraduate degree in exercise science from Virginia Tech and his doctorate in integrative physiology from the University of Colorado at Boulder. Following a postdoctoral fellowship in molecular cardiobiology at Johns Hopkins School of Medicine, Dave joined the faculty of ECU in 2008. His laboratory focuses on cardiac electrophysiology, spanning the level of intact heart down to isolated heart cells, and further down to the powerhouses of the cells or mitochondria. A major question of focus for him is, how does the metabolic state of the heart influence the activity of cardiac ion channels and vice versa? There is increasingly strong evidence that activity of cardiac ion channels can influence the susceptibility of the heart to arrhythmias, infarction, and mechanical dysfunction. Upon his arrival at ECU, Dave quickly became acclimated to industry-sponsored research by partnering first with Galeon Pharmaceuticals, then with Stealth Biotherapeutics. It was through these relationships that Dave successfully leveraged nearly $800,000 in industry-sponsored research into research grants from the American Heart Association and the NIH. In addition to an R15 award based on highly meritorious research, he was awarded an R56 award that later transferred into an R01 award. All of these awards are from the National Heart, Lung, and Blood Institute. Now it's my pleasure to turn over the program over to Marty, Bob, Roy, and Dave.